there's something in your medicine cabinet right now that could be harming your brain. No, I'm not talking about some rare, dangerous drug. I'm talking about common medications, stuff people take every single day for things like allergies, anxiety, or even heartburn. What most people don't realize is that some of these medications have been linked to memory loss and an increased risk of dementia over time. Now, before you panic, this doesn't mean that everyone who takes them will develop dementia. But if you've ever noticed yourself feeling more forgetful, struggling to concentrate, or dealing with brain fog, your medication could be playing a role. And here's the part most people never hear. There are safer alternatives to many of these drugs. Things you can do to protect your brain health without giving up effective treatment. By the end of this video, you'll know exactly which medications to watch out for, how they affect your brain, and what you can do to reduce the risks. And at the very end, I'll share a critical tip that can help protect your brain, even if you need to stay on these medications. If you've ever taken any medication in your life, hit the like button. Let's see how many of us have been unknowingly affected by this. All right, let's get into it. Let's start with one of the biggest culprits, anticholinergic drugs. You might not recognize the name, but you've probably taken them before. These include common over-the-counter medications like Benadryl, as well as prescription drugs for an overactive bladder, motion sickness, and even sleep aids. These medications work by blocking a neurotransmitter called acetylcholine, which is critical for memory and learning. Now, that might not sound like a big deal, but research shows that long-term or high-dose use of anticholinergics can lead to cognitive decline, confusion, and memory problems, especially in older adults. A study from the University of Washington found that people who took high doses of these medications for 3 years or more had a significantly higher risk of developing dementia later in life. So, if you're regularly taking something like Benadryl for allergies, or certain sleep aids that contain anticholinergic ingredients, it might be time to look for alternatives. And speaking of sleep aids, that brings us to the next category. Benzodiazepines, or benzos for short, are medications used to treat anxiety and insomnia. You might recognize names like Xanax, Valium, or Ativan. These drugs work by slowing down the central nervous system, making you feel calm and relaxed. But here's the problem. Studies have found that long-term use of benzodiazepines is strongly linked to cognitive impairment and a higher risk of dementia. Why? Because these medications interfere with brain function over time, leading to memory issues, slowed thinking, and even an increased risk of falls in older adults. The real danger comes when people take them for years, believing they need them to function. But doctors now recommend that these medications only be used for short-term relief. If you've been on benzodiazepines for a long time, talk to your doctor about tapering off safely. Stopping suddenly can be dangerous, so always work with a medical professional. Now, what if you're taking a sleeping pill that isn't a benzodiazepine? Let's talk about that next. Ever heard of Ambien? What about Lunesta? These medications, known as Z-drugs, are marketed as safer alternatives to benzodiazepines for sleep. And while they may have fewer addictive properties, they still come with serious risks. Z-drugs work in a similar way by slowing brain activity, but over time they can cause confusion, brain fog, and an increased risk of dementia, especially if used long-term. Here's the kicker. A study published in the journal BMJ found that people who frequently took Z-drugs had a much higher chance of experiencing memory issues later in life. So what's the solution? Experts recommend trying cognitive behavioral therapy for insomnia, improving sleep hygiene, and reducing screen time before bed. These changes can actually help you sleep better without the long-term risks. But what about medications that don't affect the brain directly, like the ones you take for heartburn? Let's talk about those. If you suffer from acid reflux or heartburn, chances are you've taken a proton pump inhibitor at some point. These include drugs like Prilosec, Nexium, and Prevacid. They work by reducing stomach acid, but there's growing evidence that long-term use may be linked to a higher risk of dementia. One theory is that these drugs interfere with the body's ability to absorb vitamin B12, which is crucial for brain function. Another theory is that they alter gut bacteria, which can indirectly affect cognitive health. If you're relying on PPIs for acid reflux, talk to your doctor about whether you actually need them long-term. In many cases, diet changes, weight loss, and avoiding trigger foods can be just as effective without the risks. But let's move on to a medication that has been around for decades and is still widely used today. One that could be affecting your brain without you even realizing it. Tricyclic antidepressants, or TCAs, are an older class of antidepressants that include medications like amitriptyline, nortriptyline, and imipramine. They can be effective for depression and chronic pain, but they also have strong anticholinergic properties, which means they block acetylcholine just like Benadryl. This can lead to memory problems, confusion, and cognitive decline over time. If you're on a tricyclic antidepressant and you've noticed brain fog or forgetfulness, talk to your doctor about newer alternatives like SSRIs, which have fewer cognitive side effects. Now, we've covered 5 medications so far, but we're just getting started. In the next part, we'll go even deeper into the remaining 5 medications, how they affect brain health, and of course, the secret tip at the end that can help protect your brain, even if you need to stay on some of these drugs. Now, this next category of medications is a bit more complex, but it's important to talk about. Antipsychotic medications like Risperdal, risperidone, and Zyprexa, olanzapine, are typically prescribed for serious mental health conditions like schizophrenia or bipolar disorder. In some cases, they're even given to dementia patients who experience severe agitation or hallucinations. But here's the problem. Studies show that antipsychotic drugs can actually make cognitive decline worse, especially in older adults. They work by blocking dopamine, a key neurotransmitter in the brain, but over time, they can lead to sedation, slower thinking, and even a higher risk of dementia in long-term users. Now, for some people, these medications are necessary, but if you or a loved one is on an antipsychotic, it's worth discussing with a doctor whether lowering the dose or trying alternative treatments could help reduce the risks. And speaking of medications that affect brain function, let's move on to a surprising one: cholesterol-lowering drugs. Statins are some of the most commonly prescribed medications in the world. If you've been prescribed Lipitor, atorvastatin, or Zocor, simvastatin, you're probably taking it to lower cholesterol and reduce the risk of heart disease. And that's a good thing, right? Well, here's where things get tricky. Some people taking statins have reported memory problems, brain fog, and slowed thinking. Now, the research on this is mixed. Some studies suggest that statins might actually protect against dementia by improving blood flow in the brain. But other studies show that in some people, statins may interfere with the production of cholesterol in the brain, which is necessary for healthy nerve function. So what does this mean? If you're on a statin and have noticed mental fogginess or memory issues, talk to your doctor. There are different types of statins, and sometimes adjusting the dose or switching to another medication can help. And that brings us to another class of medications that can slow brain function: seizure medications. Anticonvulsants, or seizure medications, are commonly used not just for epilepsy, but also for mood disorders and nerve pain. Some common ones include phenytoin and topiramate. The problem is these drugs slow down electrical activity in the brain, which is great for preventing seizures, but not so great when it comes to memory and cognitive function. Over time, some people on anticonvulsants experience slowed thinking, brain fog, and forgetfulness. If you're on one of these medications and feel like your memory isn't as sharp as it used to be, it's worth discussing whether adjusting the dose or trying another medication with fewer cognitive side effects could be an option. But let's talk about a medication millions of people take every day: blood pressure medication. Keeping your blood pressure in check is critical for preventing strokes, and strokes themselves can lead to vascular dementia. But here's where things get complicated. Some blood pressure medications, particularly beta blockers, can make people feel tired, mentally sluggish, and even more forgetful. Why? Because beta blockers slow down the nervous system, which can sometimes lead to reduced blood flow to the brain, causing brain fog or trouble concentrating. Now, this doesn't mean you should stop your blood pressure meds, but if you've noticed a difference in your mental clarity since starting them, ask your doctor if there's a different medication that might work better for you. And last but not least, let's talk about a medication that millions of people take without even thinking twice. If you've ever taken something like Tylenol PM, Advil PM, or other nighttime pain relievers, you might be unknowingly exposing your brain to cognitive risks. Many of these products contain antihistamines, which cause drowsiness by blocking acetylcholine, the same neurotransmitter that anticholinergic drugs block. Over time, frequent use of these medications can lead to daytime drowsiness, confusion, and even long-term memory problems, especially in older adults. Because they're sold over the counter, most people don't even think about the risks. But if you've been using these nightly to help you sleep, it might be time to look for safer alternatives. Now, at this point, you might be wondering, if some of these medications are necessary, how do you reduce the risks and protect your brain? That's where the secret tip comes in. Alright, if you made it this far, you're about to learn something critical. There's one powerful strategy that can help protect your brain, even if you need to stay on some of these medications. The secret? Neuroprotection. Neuroprotection is all about strengthening your brain against damage. And the good news is, you can do this naturally. Here's how. First, exercise regularly. Studies show that even moderate exercise increases blood flow to the brain, reduces inflammation, and promotes the growth of new brain cells. Second, eat brain-boosting foods. Omega-3 fatty acids, found in foods like salmon, walnuts, and flax seeds, help support cognitive function and protect against memory loss. Third, prioritize quality sleep. If you're struggling with insomnia, try natural methods like reducing blue light exposure before bed, meditation, or magnesium supplements instead of reaching for sleep aids. Fourth, keep your brain active. Read books, learn new skills, do puzzles. Anything that challenges your brain and keeps it engaged. Fifth, manage your medications carefully. Don't stop taking anything suddenly. But if you're concerned, talk to your doctor about alternatives or lower doses that might have fewer cognitive effects. And finally, consider supplements that support brain health, like B12, vitamin D, and curcumin, which have been shown to support memory and cognition. If you follow these steps, you'll give your brain the best possible chance at staying sharp and healthy for years to come, even if you need to stay on certain medications. We covered 10 common medications that have been linked to memory loss, brain fog, and even an increased risk of dementia. Some of these medications, like anticholinergics, Benzodiazepines, and sleep aids, are particularly risky when taken long-term or in high doses. But the good news is, there are ways to protect your brain through lifestyle changes, better sleep habits, brain-boosting foods, and working with your doctor to find safer alternatives when possible. Now here's your challenge. Take a look at the medications you or a loved one take regularly. If any of these are on the list, talk to your doctor about whether they're still the best option for you. And if you found this video helpful, make sure to hit the like button and subscribe for more content like this. Thanks for watching, and I'll see you in the next one.